the critical element that I will tell you that I think is the single key to the, if you will call it the acceptance or the love of our product, has been that we've created every single thing that we've done with older adults.
What happens when a Hasbro toy project spins off and turns into an AgeTech startup? In this episode of the AgeTech podcast, I talked to Ted Fisher, co-founder and CEO of Ageless Innovation, about building and scaling pet robots for older adults. Ted, welcome to the show.
Yeah, thanks so much. Been a while since we chatted, but please enjoy your podcast and our conversation.
Thank you. Thank you very much. So could you give us a little background story, some of the origin story behind why you started Ageless Innovation?
Sure. So the Joy for All brand actually was a project that I worked on as an executive at Hasbro, one of the world's largest toy companies. And, our mandate was to leverage Hasbro's assets in new markets and new channels. And so what we focused on was the broader, sort of health and wellness. So that was sort of the big bucket that we chose. And as we did our research, we found a few things. One, we saw this unmet need with older adults to bring more fun, joy, and play. But then we also, as we talked to folks, realized that there was this incredible need for interactive companionship and this epidemic of loneliness and isolation well before the pandemic. And so that was the origin story. So we launched Joy for All, Hasbro's first ever brand for older adults, back in 2015. And we launched with our first companion pet cat, and then followed quickly with a dog because the dog lovers of the world demanded it. And so we ran it inside of Hasbro for about 4 years. And then really both Hasbro and the management team felt that the opportunity to really focus 100% on older adults and their families was big enough that we should spin this thing out and make its own company. So myself and a couple co-founders, we founded Ageless Innovation, and then we acquired the Joy for All brand from Hasbro. So since 2018, we've been running it as our own company and our own brand. So that's the quick version of the origin story.
And it's a quite unique origin story. I can't think off the top of my head of any AgeTech startup that started out this way, and certainly like spinning out of a toy company that is quite unique. So what has been sort of your journey as an entrepreneur since you started? What would you say are like the big milestones that Joy for All has had throughout the years? And if you had any things that you would have done differently to maybe reach some of these milestones faster as an entrepreneur?
Yeah. So this has been my first entrepreneurial venture. I've been part of a few early stage and startup companies in my past, but this was really the first in the consumer products space, trying to bring, really unique and different products to market, but also, we kind of created a category, before companion pets at scale. It really didn't exist, this idea of robotic companions for older adults. So I sadly have been saying this a lot lately, but if you want to be really challenged as an entrepreneur, start a business in 2018, because, the milestones that stick out are, a pandemic, a global supply chain crisis, inflation, even tariffs. So, every year or a year and a half, we've been hit with something new, some new challenge that, as an entrepreneur, you don't really anticipate. You sort of once you get over these big hurdles, you hope, the path then becomes a little more clear. And we faced a couple challenges since then. But I think from a business standpoint, the growth has been, and the adoption of our products has been, really something that keeps us moving forward every day. In terms of the pets, we have now over 700,000 of them deployed and adopted around the world in about 25 or so countries. And so the globe has been part of those milestones, continuing to grow and scale our footprint in both the direct-to-consumer channels, but also the health channel has been, another really significant milestone. And we've really been focused on that health and wellness space, for the last number of years, as the impact has been validated by numerous studies. And so, all these little foundational steps, I think, has led to, us really understanding that older adults have tremendous needs, obviously, as do all consumers. They're a category and a demographic that's not focused on nearly as much. And certainly as it relates to sort of the fun, joyful, playful side, we saw the void early on, and now there's more, thankfully, more companies coming into this space. But a couple of years ago, we signed an exclusive agreement with Hasbro, who had some insights that older adults, they were seeing a spike in the use of their games and their iconic board games by older adults, but we're getting some feedback that they weren't as easy to play or as inclusive or as fun as they could be. And so, they reached out to us and said, hey, we're seeing this trend. We think there's an opportunity to reimagine these games. And so we signed an exclusive agreement with them to take all of their iconic games. They think of Scrabble and, Yahtzee and a bunch of other things, and sort of reimagine them for older adults and their families. And so we launched that business about 2.5 years ago, and now have over a half dozen games in the portfolio. So those are a couple milestones, but working with a great team and continuing to surround myself with people who are passionate about this is probably the number one thing. And then serving this community is at the very top.
You mentioned that you ran some studies throughout the past few years, and that is something that many AgeTech startups decide to do at some point in order to prove basically not just that the product does what it's supposed to do, but also that it is effective in improving health outcomes, reducing loneliness, and so on and so forth. So could you maybe take us through your thought process, or maybe the internal discussion you had at the company, and what made you go do some of these studies? Because I know it requires significant resources from a startup.
Yeah, so we had a few fortunate things happen. So when we were at Hasbro, we really were focused on the health and wellness impacts, because immediately we started seeing the anecdotal evidence, and the two need states were really loneliness and isolation or depression, and then dementia and Alzheimer or cognitive decline. And so as we started to see that impact, honestly, and I'm not speaking out of school, Hasbro would say the same thing. None of us had any sort of expertise whatsoever in any of those areas. And so, it felt early on that it was critical that, we validated this anecdotal evidence that we saw. And we had a really fortuitous meeting with United Healthcare in like the first 9 months after we started the brand. I had a friend who'd sold his company to United Healthcare. I called them up. I said, listen, we're really looking to be in the space, and I'd love if you connect me with a couple of people who could help me. So we flew out to Minnesota. We met with this team of people, and it was one of the folks who focused on community and state, which is their Medicaid side of their business, was really interested in loneliness and isolation and thought that we had a great solution. And so fast forward, AARP and United Healthcare paid for the first studies to be done, the really significant studies. We now have about 12 to 15 peer-reviewed, published, studies that really validate, the positive impact, and since have been covered by Medicare and Medicaid through CMS. So, that critical study, that first one, they funded, and they did it because they saw, what was happening in the space and the outcomes. And then, all of a sudden we're facing a pandemic where loneliness and isolation become the biggest issue, and it's a huge spotlight on the topic that hadn't been there before. And so then we started working with the state of New York as our first state partner. They had done a pilot program and a year's worth of research on our product. So all these things sort of happened concurrently. And all of a sudden now we had this body of research that really validated the impacts. So, we were kind of right place, right time, but we were maybe even unintentionally meeting a need, because our whole thing was fun and joy and companionship. And so not at that time when we launched, we didn't really understand the loneliness and isolation epidemic as we do today. But we quit, within the first year, we saw it everywhere. We, started to see people talk about, hey, my mom hadn't talked to anybody and blah, blah, blah. She's been using your pet and it makes her happy and brings her joy. And now people come to her. And, so we started hearing all these great evidence-based, sort of stories. And so we really leaned into that.
That is amazing. So you ran these studies, and that's sort of what got you the stamp of approval to get covered by Medicare and Medicaid? Is that what happened?
Yeah. So we had probably at that time, New York had done a big study. We had the AARP, United Healthcare study, and then we had probably 6 smaller studies that had been done here and in the UK and a couple other places. And believe it or not, there was a plan in Minnesota that had seen our products and thought that this was, they just said, we have to be able to cover this. So they, again, going through that process of getting CMS approved can take, years. And we fortunately did it with a partner who really sort of knew the ropes, advocated for it because they had seen the impact. And so it took a couple of years and we ended up getting, approved in Medicare as an SSBCI and in Medicaid as an assistive technology.
That is amazing. I think that is sort of the holy grail that so many startups who are just starting out aspire to, because that sort of unlocks a whole new revenue stream, potential revenue stream. Even if you have to go and convince plans to use you,
Yeah.
you have that stamp of approval. So what type of advice can you give to startups who are just starting out and have this product that they know works and they know that it improves health outcomes, but they just don't know where to get started, where to find a suitable partnership to run a study, and then how to get it in front of the right people to show that it works?
Yeah. In every business that I've had and sort of every, sort of entrepreneurial part of my journey, I believed in this idea of finding your champions. And so if you can find your champion in the right places, right? And it's really, I try not to, and I won't say waste time because that's a poor terminology, but I'll just use it for succinctness. If people don't get what we're trying to do, there's a mountain of time required to convince them and show them, right? And then we have tons of converts who thought, oh my goodness, this is, my goodness, this is really infantilization, and we're trying to replace human interaction with robots and the whole. And what we found in every case is that our products actually enhance human connection, which is fantastic. And we're not trying to replace human interaction. What we're trying to do is fill a void where we know there's not. But if I have to convince people of that, it takes a lot of time. If I can find the person in the organization or in an organization that, in a group of organizations that really gets what we do and becomes passionate about what we do, those champions can drive a long way. So for example, and a lot of folks know, because I speak all over the country with Greg Olson, who's the state director of the Office of Aging in New York. And Greg and I have been, not only colleagues, but become close friends with a very shared mission, right? And he did a pilot with our products in 2019 for a year and found some great results, 70% reduction in, loneliness, isolation, depression, and then pain. They did a pain scale test, and those who had received pets there, they were at a 9 and they went to a 2 in terms of pain, which, is a great indicator for who's going to end up in the emergency room and who's not. And so he was super enthusiastic. And then fast forward again, it's a moment in time, but all of a sudden, New York's the epicenter in the US for COVID when it first started. And so he called me in, I think, February of 2020 and said, listen, that pilot that we did, and he said, we got to deepen this partnership fast because he saw it coming. He said, we're about to face the worst epidemic of loneliness and isolation this country's ever seen because we're about to close people in their homes. So, usually public-private partnerships take years and years to do. We had a contract signed in 2 weeks, and in 2 more weeks, we had 1,000 pets out in the state of New York to those most in need. And, that champion, in Greg, who continues to be an unbelievable partner and champion today, but during COVID, he would get on a call weekly with his counterparts around the country who weren't quite facing the epidemic yet, right? In certain states, it really hadn't even gotten there. And he was saying, here's what's coming, here's what's happening, here's what we're doing. And he talked about our program. And then, well, in the next 6 to 12 months, I probably had 25 plus partnerships with states and AAAs around the country because they saw the success of the program. So, I really believe for entrepreneurs that finding your champions is critical, and being able to discern who's not going to be your champion fast is a time saver and super helpful. So
that is such valuable advice. And you also touched on a really important point regarding social robots in general. I love robots, and I'm a firm believer that we will all have robot caretakers someday, not just social robots and not just vacuum robots.
Right.
And some people like feel that is like a dystopian future. to have social robots in our homes, but they forget that the reason why we have a loneliness epidemic is because so many people just don't have anyone to talk to. So many people, especially older adults, just don't have anyone coming into their home. So it's not to replace humans, not at all, but it's to fill a void that currently exists.
Right.
So it sounds to me that, first of all, obviously the partnership with the New York State Office on Aging was super, super helpful to get you, again, another stamp of approval and get your partnership with other states throughout America. And also, obviously, getting into Medicare and Medicaid is hugely important. And also another thing that I think sort of sets you apart is that compared to a lot of hardware products in our space, your robotic pets are quite affordable, aren't they?
Yeah.
And they're easy to get. So it's one of those few products that people can just go online and get it for themselves. They don't necessarily have to go through the reimbursement route to figure out who's going to cover it. And I guess that leads me sort of to my next question. What made you decide that you were going to do both direct to consumer and go through Medicare and Medicaid and the New York states? Because you could have decided that direct to consumer was required too many resources, and that you didn't necessarily want to provide customer support and technical support and everything else that direct to consumer entails. So what made you decide, after you have reached significant adoption with B2B or B2G, to do direct to consumer still?
Yeah. So think about where we started, right? We started at Hasbro. And by the way, to your point about affordability, just to put a bow on that, I mean, I think one of the great, good luck, good fortune, call it what you will, is that we actually started this brand inside of a really high quality organization that makes great products, but because of the consumer that they serve, they make them at very low prices so people can afford it. And there's so much innovation and so much technology that happens within the walls of Hasbro that ends up in toys, that kids have. But there's also an expectation that toys cost X. And so that was a huge advantage to us, because what we see in the social robotics space is that, a lot of people are choosing the one-to-many model where, you have one because it's really expensive and it serves a whole lot of communities. We've always felt like the one-to-one relationship. So it's your pet, you own it, you name it. There's a magic to that that's really hard to replicate, right? So then when you feel like it's yours and you're caring and feeding for it. And so again, I would love it if everybody had somebody to talk to, a human. I would love it if everybody had their own pet that they could take care of. But the absolute reality is that's not the reality, right? That there is a need, there is a void. So we started at Hasbro. And honestly, the only channel available to you at Hasbro is the toy aisle of big box retail, right? Because that's where they sell almost 100% of their goods. They do some online direct to consumer, but at the time, pretty much that was it. So we were going to launch as Hasbro, one of Hasbro's first ever products that was on our own website only. So joyforall.com, which we had. And about a week or two before we were about to launch, I had this dream that no one would ever go to a place called Joy for All and buy anything. So I called the buyer at Hasbro and I said, hey, listen, can I get a meeting with the Amazon people and just say, hey, we've got this product, and I don't care if they just buy 5, but as long as I can be also available on Amazon, and so we ended up in that meeting. We talked to the Amazon buyer, and he had a situation where he had a parent who had, dementia, and he just totally got it. And he's like, I love this idea, we're in. So they didn't buy a ton, but they bought enough. And so I could put on our website, also available on Amazon. Well, we launched, and 48 hours, Amazon sold out. And so we had another order. So the direct to consumer was actually how we started. And what we saw was that there were going to be people who could go there and buy it and self-pay, who could afford to do that. But we also saw there was a huge population who potentially could not. right, that needed a sponsor or a payer. And our intention as we launched this, larger part of Hasbro was this idea of Hasbro Health was to get into that space. And so we really thought of the direct to consumer as sort of our runway revenue to get to the place where we can launch this, this healthcare brand. And, I would argue that there's very few companies in age tech that have successfully managed both. And so I have a team that manages our what we call our payer sponsor side, which is, all the healthcare state offices on aging, VAs, Medicare, Medicaid, et cetera. And then I have a team that manages the direct consumer retail partners that we have around the world. And so we have distributors in 20 something countries. And so, we try to manage it the same way in every country, that there's a direct consumer path and that there's a, payer sponsor path.
That, like I said, it sounds like it requires a lot of heavy lifting on your part.
It is.
But I get it, and I assume that even for your team, that having your own users and not necessarily going through a proxy is super, super helpful when it comes to developing the existing products and when it comes to developing future products, and also when it comes to sort of figuring out what your marketing messaging should be. And that sort of leads me to my next question. You mentioned that you sold out in 48 hours. I can't recall off the top of my head any AgeTech startup that had like a physical product that did that.
Yeah.
What did your marketing campaign look like?
It was really interesting. And I forget now what happened. First of all, they didn't buy a ton. So it wasn't like we sold, 100,000 units or anything like that. It might have been 500 or, I'm not even sure how many it was, but it was very small order. But somebody posted something online. We had done a marketing campaign, and, back at Hasbro, it was a lot different, right? We had marketing teams, you had US marketing, you had global marketing, you had brand marketing. And so we had people on my direct team that were, sort of product marketers. And then we had people, in the US marketing team that worked with all the retailers, putting these programs. And so they were expert. And so I wasn't expert at this. And so we successfully, put out this sort of big emphasis and had some great older adult models, that work with us. And we had preceded we had gone out and, given them to some people in assisted living and memory care, and just gathered some great stories for people who really had impacted, and the caregivers to those that, were recipients. And so that, I, back in the Hasbro days, I had a little bigger marketing budget than I do now, but, that's a whole nother story.
Yeah, that was my next question, because I bet that you had to spend a lot of dollars on acquiring those early customers when you were basically unknown. I mean, people had never heard of the company and have never heard of the concept of a pet robot before.
Yep.
So
yeah,
that definitely sounds expensive.
We did a great activation, like right from the beginning, with Meals on Wheels. And so, we were looking for a cause-based partner that we could, be sort of on the front end of the launch with. And, Meals on Wheels was just they were addressing so many of the same sort of constituents that we are, right? Because their motto is it's more than just a meal. So they go in, and my team does every Tuesday we do a Meals on Wheels delivery. So I'm on the board here in Rhode Island. Like, Meals on Wheels become a huge part of our world. But when you go and you physically deliver a meal, it's really not just a meal, it's a wellness check. It's, it's a social interaction. During COVID, my daughter and I picked up a route here. My daughter's, got sort of, extracted from her junior year in college, and everybody shut in. And so I knew the head of Meals on Wheels locally, and I said, listen, we love to do something that, turns this to a positive situation for my daughter, who's home now and not with her friends. And we ended up doing this for just about a year together. And we had the same 20 people who became part of our family. And they saved my life during COVID, right? Because I was never shut in. I had to go deliver these meals. Every day I got out for a few hours to do this. And I became, and we were the communication between the people, because it turns out that these folks. So when we were looking for a partner to sort of, say who is serving the same demographic that we are, we looked at Meals on Wheels and we went, and I think we did about a dozen activations around the country where we, donated a pet with a meal. And we went out on a route and, we did it on the East Coast, the West Coast, and the South, and the Midwest. We did it all over the country. And it was spectacular, like really wonderful. But in Rhode Island, when we did the first one, the governor of Rhode Island, was with us. The CEO of Hasbro was with us. The CEO of Meals on Wheels. Like it was a big deal. It generated a ton of press. And so one of the things that, I'll say about the marketing effort is because we were so unique and different, we got a ton of media, like a billion media impressions the first year, like a billion, like, crazy, like articles. In our fourth week, we had an article in the New York Times Magazine about this guy who had, walked in and saw his grandmother with this cat, and she hadn't remembered him in months. And she walked in and he's interacting with this cat. And he said it was as if we were 5 or 10 years ago. She remembered me. She laughed, and he was giving props to this. So that, when that hit, another, huge sort of boom. And so we continue to this day to get great press and great media. And then most of that's free, right? So, there's a lot of great stories we try to continue to do good work, which, generates good stories.
Wow. A billion views or impressions. That is unheard of.
Yeah, I
So that
think we've
was,
got over 10 billion since we started the brand. Like, so it continues
wow.
like a billion a year. It's crazy. Yeah.
Wow. Well, I think that's like one of the advantages of having a physical product. The press loves to cover these things. And I mean, if you compare it to software, which is
Yeah.
sometimes like there's nothing to actually visual to show, then yeah, it's easier perhaps to get press coverage.
Yeah.
So that was actually my last question. Is there anything that we didn't talk about that you'd like to add? Any call to action to entrepreneurs in the audience?
Yeah. I think, to your point about expensive marketing, we did have probably a healthier marketing budget than most startups have, but we really leaned into the idea of PR, right? And trying to create, I don't think it's a verb, but I made it a verb, create PRable events. And so, we've done annually, we do, we have partners that we work with, and we go to VAs, which is the Veteran Administration hospitals here serving, our military veterans. And we do hundreds and hundreds of pets a year there. And we partner with great organizations that are trying to serve older adults and, are working on loneliness and isolation. And so, as we do these things, we typically try and we do an event that's typically not run by us, but someone else. And so, what I would say is if you can figure out how to, do some good that gets coverage, that's really inexpensive press with limited marketing budgets. So that's been part of our strategy, I guess. And the other thing I'd say is, I really recognize, since I've done other startups, how fortunate we were to launch this brand inside of a, $5-6 billion company, right? That's, not everybody has that luxury. But since we've spun out, we have every single issue that all small businesses have. Cash flow is always an issue, product development, is always sort of like where are we going and how are we developing? And we get a small team. I mean, I think we're 12 or 13 full-time people. And then, when we're developing product, we swell up with contractors, and most of them are people we work with back at Hasbro, are really creative innovators who have gone out on their own. And so, at any one day, there could be 25 people in the office if we're in creation mode. But the critical element that I will tell you that I think is the single key to if you will call it the acceptance or the love of our product, has been that we've created every single thing that we've done with older adults. We don't assume anything. We don't, as that we do extensive testing. We have a whole room. You can't see our office. I'm pointing over there, but we have, a 6,000 square foot office in an old mill building. Lots, we have a big open space that has tables, game tables, and we bring older adults in, we bring people and we play. and we test and we iterate and all the features of our pets. They're all things that were told to us by older adults. Like we heard that, when cats, purr, they physically vibrate. Like there's a tactile sensation that people love. And so we created a technology called VibraPurr, and that's something that older adults wanted. That affordability piece, by the way, is something we heard from every older adult. They want to be able to afford these things. And so, tariffs are sadly, causing us to raise some pricing, but we've only, I think in 10 years, we've only raised prices once before tariffs. And so, that's a really important component to us. But the single most important component is that we design every product we have, not just for older adults, but they're by older adults. They're part of our team. And we feel so lucky that we get to serve the space.
Thank you so much for this wonderful advice, Ted. I think that is a critical component to any successful age tech company, to really build not just for older adults, but with older adults. Because otherwise, like you could never guess what people actually want unless you talk to them, and having the space in your office to invite people over to come and play with whatever it is that you're making. It must be so valuable for your team to be able to have these interactions and to basically build what people want.
Yeah, 100%.
Awesome. So thank you so much, Ted, for joining me on the show today. As always, it was an absolute pleasure chatting with you.
Yeah, thanks so much. I enjoy all of your work, and I'm really, really excited that I got the invite to join you today. I've been listening to your podcast for a long time.
Thank you. If you found this conversation insightful, we've got another one for you right here. Until next time, stay humble, stay curious,